And go. All right, Mrs. Garcia, thank you for coming. I know you have some questions about your new diagnosis. I'm your respiratory therapist. Please don't be afraid. I'm Glenn. I'm here to help you and help you with any questions you may have. I know you were here fairly recently, and you were hospitalized, and you required quite a bit of attention. You required antibiotics, and you were hospitalized for 4 days, and you were even on BiPAP. They want you to go now incorporate some bronchodilators, and they want you to also use your inhalers correctly. I know you just had a follow-up where you did your PFT to confirm your diagnosis. So at this point, I would like to see if you had any concerns about that you may have about emphysema.
Emphysema? I thought I had COPD.
Okay, well that's a valid concern. COPD, there's a lot of different areas of COPD, and one of them is emphysema. So you also have chronic bronchitis, but one of the types of COPD, so it is COPD, you're right. However, one of the types is emphysema, and it's very particular, and that's why we needed to do your pulmonary function test, because with emphysema, as a lot of the literature we give you, we try to give you a little bit of, just stuff for you to be familiarized with your disease process. So with emphysema, it's a lung condition, and in this lung condition, you're gonna damage what's called the little air sacs. We call those the alveoli.
Alveoli? That sounds like an Italian dish.
Well, yeah, I know, but it's a big word. But basically, what it means is this little air sacs. We all have it. But what happens with emphysema due to the chronic, you have the chronic smoking, all the other circumstances that deteriorate your condition, these air sacs become more deteriorated, and they have that perforating. So that's what we call that. So you have less air space, and now for you to get oxygen is going to be a little bit harder. However, we've been working on some techniques, and we've been working with your first sleep breathing. How's that going for you?
It's taken it's coming.
It's coming?
Yeah.
Very good. Good. Okay. Remember also, when we do first sleep breathing, I want you to remember that all these muscles, these are accessory muscles, and what you're gonna find is that this is your primary muscle of ventilation. So I definitely want you to think that you're breathing with your belly. This is your diaphragm. It's another big word, I'm gonna throw it out there. But I want you to be aware that if you breathe through your diaphragm, it's gonna be a little more effective for you.
Okay.
So go ahead and put one hand right here, one hand in your chest, and then there you go. Only this hand should be moving. So when you breathe through here, take a nice and deep breath in, and exhale with your lips are gonna be almost closed. You should notice this hand, and then make this hand go lower. That's what we call first sleep breathing. I know from your nurse, you were wondering what happened with your discus. Is that some other concern that you have?
Yes.
Okay. Basically what we did is we replaced the Advair that you're used to, and we're not in charge of this, but what happened now is this Advair, this is a maintenance drug. So Advair is going to be now Symbicort. It's the same medication, so your purple disc is not going to be a red puffer. That's a whole difference. But they should do the same. They should alleviate the irritation that happens that triggers exacerbations. Okay. Also, you had a question. Do you have any other questions about medications or more treatments?
Yes, they gave me another funny-looking thing, and
Yeah.
It's got a pill. Am I supposed to take it with water?
No, please don't do that. The way we go about that, you're gonna have this canister, and you're gonna put it here, and that one's for breathing. That was gonna be once a day for your breathing.
Okay.
You're gonna close it, you're gonna actuate it, and then take a nice and deep breath in, and hold it. I also, for the sake of the demonstration, I'm also gonna give you a spacer so you can use with your albuterol as well. That you're gonna take, but those are rescue medications. I want you to remember, these are maintenance. The other ones are rescue. Okay. We have a picture about what I was talking about, your alveoli. This is how they will look like.
Okay.
That will be more like a normal of healthy, and this will be something unhealthy, like kind of what happened. But your symptoms can definitely be controlled if you take your medications.
Okay.
Okay?
Okay.
So I know sometimes you feel hesitant about taking them, even though you feel fine. I want you to remember those are maintenance, so you gotta keep taking them on a regular basis.
Okay.
Okay. We give you a few websites that you could visit. There's always good resources online, and we also hand them to your family, your daughter I spoke to, very pleasant. For emphysema, the Mayo Clinic definition. We also, a lot of the things that we recommend you are by the gold standards. So keep that in mind. It's not just me making things up or wanting you to take medications. These are research and they're evidence-based. Okay.
Do I have to attend pulmonary rehab?
I would highly recommend it. Pulmonary rehab, according to American Thoracic Society, is a comprehensive and it's a intervention that's very comprehensive, and it's based on the patient's assessment and followed by a patient and tailored by therapists. This type of intervention would include exercising, education, and behavioral change, and they're also designed to improve your emotional condition. And that's, again, that's proven by the American Thoracic Society. I drew you a little diagram here.
Okay.
Hopefully this will encourage you.
Okay.
So this will be a vicious cycle that unfortunately a lot of people will fall into when they don't have these resources. And when you follow a program on a pulmonary rehab, this reverses cycle. So unfortunately people they have depression and anxiety because like you, they just find out some unpleasant news, they have a new diagnosis. So unfortunately that will increase their breathlessness because now they don't know how to use their medications and they are not exercising, they're being more sedentary, which reduces their activity. They become a little more passive. And then this leads to social isolation, which also leads to depression. So this becomes a vicious circle. Hopefully, through the process of rehabilitation, you could reverse this cycle and start doing exercises. Now these exercises, it's not gonna be something that is incomprehensible for you. We're definitely gonna try to do stuff that is very close to something that you will do in real life. So the expectations, you'll meet expectations, don't worry. Relax.
Okay.
You'll be quite alright.
Okay.
Okay?